When you are extracting teeth, always, always, always make sure that you have something protecting the airway of the patient. A couple things can happen. One, you can be squeezing a tooth with a restoration. All of a sudden, boom, the restoration breaks and goes flying, and now you've got a chunk of amalgam or a crown that's gone down the throat, and we have no idea if it's entered the trachea or the esophagus. Now, same goes for a tooth. Let's say that we have a perfectly healthy tooth, even for like a orthodontic extraction. We're going to grab this lower premolar, we're getting it out, all of a sudden, oh, look out, we dropped it. Now, if we don't have some protection there, same thing, the patient can swallow this or it can end up down the trachea. Now, if this happens to you, the proper protocol is to send your patient for some imaging. They need to have a chest x-ray done and they need to have an abdominal x-ray done. And basically what they're looking for is they're looking for the location of that tooth. Now, the best case scenario here is that your patient actually swallowed the tooth, because most times this is just going to be passed by the patient and they just have to monitor that. Now, there may be times where it isn't passed and that's a bigger problem. But your worst case scenario here is that that tooth actually falls just right and enters the trachea, where it then falls down into the right bronchus. Now, the right bronchus is kind of the straighter of the two, which is why you'll often have things go into that side of the lungs. This is normally retrieved via bronchoscopy, but if this is unsuccessful, they might have to do surgery on this patient to remove that. So this is a huge issue. Something as simple as taking a tooth out, maybe even just to create space, like I said, for orthodontics, and now you've got some pulmonary surgery going on. So we want to really avoid this. It's not really real until it happens to you. So make sure that you're practicing to the standard of care. You're using something like a 4x4 gauze, a C-sponge, laryngosponge, a isolite, a whiter retractor, whatever you choose, make sure you have something there. Don't say, oh, I've got good control over this, I won't drop it, or I'm going to catch it with my fingers or fish it out later, or I'm going to have my patient just lean their head to the side so if it comes out it'll fall in their cheek. Don't do those things. Make sure that you have something physically in there blocking the airway so that this does not happen to you.